We have the right to self-government, to self-determination of land. And the people that are here are going to go back and continue the struggle. This is not an end, it's only a beginning.
So thank you for joining us for this episode of The True Canadians, the podcast from the book by the same name. I'm David Wylynko, co-author, along with Patricia Russell. And today we're with Reagan Bartel, and you are the Director of Health Programming, is that right?
I'm the Director of Health and Seniors and the Director of Mental Health and Addictions for the Otipemisiwak Métis Government. Excellent.
And we're at the office in the boardroom here in Edmonton, and we're going to talk today about health challenges for the Métis and about Reagan's forecast for the future of that. But first, we thought, with these podcasts, we really like to sort of personalize them a little bit and learn a little bit about the people that we're talking with, and maybe you could share with us a little bit how you developed the passion you have for health, and it seems like you've had a long career in this area.
Yeah, health has been my thing for the last 20 years, David. So I began as a nurse. I think within my family, I had always had incredible nurse role models. And so my aunties in my family just showed me what caring looked like. When we lost family members, it was always the nurses at the bedside. And so I've always been inspired to care for others. So that's how I got into nursing. Left my small hometown in BC. It came to Otipemisiwak or Edmonton, where I worked in critical care for 17 years. Yeah. So it's been a passion as long as I can remember.
What were some of the most, in those experiences, what would be some of the things that sort of led you to where you are now?
The reality is I worked at the Royal Alec Hospital in Edmonton. For those who are not familiar with that hospital, it is our inner city hospital. So there are folks that experience the gamut of social issues that lead them to have poor health. Seeing the same people over and over again, some from my own community, some from outside that community, and feeling like I was putting Band-Aids on things. I was, pumping up the tires and then sending folks back out into the world with no real solutions, just back to the same place with the same factors that influence their health, and not really feeling like I was doing anything more than getting them through that day or that week or that month, but not affording any sort of real solutions for them and not having the time or the opportunity to advocate outside of the hospital or to create policies or systems that would support them in a good way. So that's how I transitioned from nursing to public health. I was looking for a way to impact change upstream. How can I help, Mr. Smith, not real names, but Mr. Smith, who comes into the hospital every month for dialysis because he's ingested a substance, not because he wants to ingest a substance, but because he's trying to numb something outside of that. And that is where the shift came. I wanted to actually make a bigger difference. Not that bedside nursing isn't a difference. I think that's an incredible field, and I've had 20 years in that space. But I wanted to see if I could stop people from coming into the ICU beds rather than caring for them while they were in the beds.
So it's interesting. Yeah, I mean, that's clearly with the healthcare system across Canada, one of the biggest issues you hear about is wait times. And here in Alberta, there's just been an election. Premier was she was either re-elected or elected for the first time. She had been premier before, but I'm not sure she took over from a sitting premier. But that was one of her big issues. In Manitoba, they just have a new premier, Rep. Canoe, who's one of his top priorities is healthcare. It always comes back to wait time. So when you mention prevention, that really resonates for sure. Just again, a question about yourself. You made a decision you needed to go back to school.
Yeah, absolutely. I think nursing is a great foundation. You'll find nurses everywhere. We're in policy, we're in frontline, we're in all of the social services. Leadership is a core value and strength, I think, of folks who choose to take nursing. But there are skills that are different. Nursing is a very task-based, somebody's having a heart attack, you treat the heart. When you're looking at systems, they're infinitely more complex. There are many moving parts. There's intersections from various ministries, all of those things, learning how to work with stakeholders, learning how to communicate, learning how to build policy and advocate for folks that may be underserved. Our own community is one of those. The Métis, within Alberta are historically underserved in health. So yeah, I needed more skills to be able to do that. I'm not saying a piece of paper is the be-all end-all. There are incredible knowledge holders within our community that may not have had the privilege of that higher education. I am fortunate. I was able to go back to school. And now I'm putting that to great use here at the Nation.
Right. So you've been in this position a few years?
Almost 4.5 years.
And then what would you have, I guess there's COVID for one. I mean, you really can't, COVID's almost a full stop problem identifier.
COVID was 3 years of my life, David, and I wrote my first COVID brief on the same day that I met my probation at work. So, 6 months in, I'm very fortunate. My background is at MPH with a sub-certificate in communicable diseases. I kind of took it for fun because I enjoyed nerding out in that area. In fact, I did have training from Dr. Dina Hinshaw, who taught me kind of about epidemiological management of influenza at that time. So when it came through, we were really fortunate in the Nation that I had that knowledge kind of fresh in my head and was able to apply that. So that was almost the first 3 years of me being here, was just pivoting and being reactive and responsive to COVID.
So if there was no COVID, or in addition to COVID, what would have been so far, what have you identified as one of the biggest challenges?
So I think it's important to note that it's not what I identify. It's what community. So my role is to amplify the voices of the more than 65,000 citizens that reside across the province. So one of my biggest priorities is ensuring that I engage in a good way from the top of the province to the bottom. So that means looking at, is there differences between rural and urban experiences? Are there differences in age gaps? So looking at it from a population perspective, making sure that we're engaging so that we can better understand what community says that they have as a priority. From that, we actually built out a vision for health. So we know what our top priorities are. Currently, we're seeking health benefits. So this has been a fight for many, many years. I'm sure folks listening, and perhaps they don't have this knowledge, but there are large jurisdictional gaps in health. What is provided to our First Nations and Inuit relations has not historically been provided to Métis in this country, certainly not in this province. We do not have access to extended health benefits. As a result, our community suffers from mismanaged chronic conditions, not because they don't know what they need, but because they potentially can't afford to access it. So that is a key priority that is coming out of our community: mental health and substance use. So that is another key thing coming out of community. So we're building out strategies. I'm proud to say that in the 4 years that I've been here, we are now able to offer Métis citizens 12 hours of free counseling through one of our programs and another 6 hours of counseling through another. So we have a total of 18 hours, which is better than most benefit plans that employers offer. So we have been able, with very little, to build out a mental health program, and we're still continuing to engage to make sure that we're not missing specific groups within our community. If we talk about our Two-Spirit folks, if we talk about our seniors, if we talk about our youth. So we're always working to better understand what their needs are within that priority. But mental health will always be a priority. Access to care. So when we talk about primary care, when I said prevention, that's one piece of it, but most of our community do not have an attachment to an actual family doctor. I mean, we know throughout the province, you've maybe experienced it yourself, it's really hard to get a family doctor. When you layer on racism, discrimination, potentially being impacted by social determinants like having a lower income, maybe having a lower education. I'm not saying that all of our community do, but we know those things impact health. And we know that we have people in our community with those lower things. So, we're working to build those safe medical homes. So I'm looking to have a Métis-led clinic. I want our own primary care clinic so that folks can travel from where they need to and know that when they are met at the door, we know who they are. We know where they come from, because identity is part of that wellness. And that's the other component, is what cultural components can we work into the healthcare system? Because right now, we know you wrote a book that told our story, but there are hundreds and thousands of Canadians and people worldwide that have no idea who the Métis people are. How can you expect to support well-being when you don't know who we are? So the idea that we could have our own facilities that serve other Albertans as well, sure, but are grounded in our ways of being, our values, that are run by people that might be community or at least know who you are. Trauma-informed, person-centered Métis care. Can you imagine anything better? Because I can't. We're going to do the same thing in the recovery space. We know that we have folks that struggle with substance use and addictions, similar to the general Canadian population. But we also know that you layer on racism, discrimination into that recovery space, and how are people supposed to recover when they're constantly worried that somebody's judging them for not only their substance use, but for who they are, because they may or may not have a visible minority look. They may or may not have a healthcare provider who has some sort of bias. I mean, we know there's studies in our province. Another Métis scholar, Pam Roach, wrote a study that showed that there are racist physicians within our province. So we are working to combat that in our department as well.
Right. You know, just recently on the news, a doctor pointed out that over 20% of Canadians don't have a family doctor.
Yeah.
And there's all kinds of reasons for that in terms of getting training up and getting people staffed in the parts of the country where they need to be, particularly rural locations and so on. But what really struck me, you know, knowing I was going to be talking with you today, was I thought for many of the reasons you've just described, it's going to be even harder for Indigenous communities and for Métis communities. And people can't appreciate this out in the so-called colonial world. But I think our listeners might not appreciate so much, and they'd benefit from you describing a little bit more what those challenges are, because it's kind of part of a broader. It's like it's any time coming into it. I mean, not to downplay the importance of primary medical care is critical, but if you've come from a largely Métis community, or you're feeling some of those racism elements in your life that you've described, then you probably feel like you're kind of hitting a mental wall in all aspects of like housing even. Right? So there's a lot of effort going on in housing with the Métis. So what would be a way that would make it even more difficult, you know, for Métis as opposed to everyone else? These other people that don't have a family doctor, it seems to me, well, they just didn't bother to go out and find a family doctor. You know, they should be able to find a family doctor because they probably have family supports, they probably have community supports, they probably have workplace supports that would make that available to them.
So I think there's a couple things I want to unpack there, David. One, most Métis people know what they need to be healthy. So, you know, there is often that stereotype that it's a lazy Indigenous person. You know, they just don't eat healthy, or they just can't be bothered to go to the doctor. And that's not often the case. I think that when we look at person-centered, trauma-informed care, what I want people to understand is that it's not just the individual. The individual tends to know what they need. But if that individual has a family and they're working a minimum wage job and they have to work 3 of them in order to put food on the table, pay the rent, for them to take a day off to go seek preventative care at a physician, how does that happen? That's not unique to Métis people, but it is something that our community experience. We know that we have folks who are working minimum wage jobs that don't actually afford the cost of living, right? So then you're working 3 of them. Health isn't your priority. Putting food on the table for your children is. That's kinship. That's community care. That's how we are. We're not going to leave our families to starve. We will suck it up. We have been told we're resilient. We see it in health. We wait until we're at death's door before we hit emergency rather than finding it. I had a dear friend who is a M&A citizen, but also very closely tied to settlements, who indicated that the first incidence of racism that their children ever had was in the healthcare system. Their first. So if that child, say, falls and breaks an arm, and you go into the doctor, and the doctor doesn't immediately, you know, they make an inference. There's a lot of times where it's not, oh, well, you know, you fell off a trampoline like a normal kid. It's fear that they might call Child and Family Services because there's a stereotype that exists that we don't take care of our family. That's what racism in the healthcare system does. And that's why people aren't seeking doctors. Small communities, it's even worse, David. So you have a single or maybe one other family physician, word of mouth gets out that that person is racist. Why would you ever go to that doctor? I mean, we've had people, removed from procedures because they were classified as a drunken Indian. That's racism in the healthcare system. So the attachment that we have, or low attachment rate for family physicians is not just because we don't have doctors. And that's typically the experience for the general Canadian population. There just isn't enough of them. Well, now you add that extra layer of the fact that when you walk through the door, you're being judged. You could come in for a gallbladder attack, David. If you are visibly Indigenous, the first question is, did you drink? You might not have touched a drop of alcohol in your life. But that's the first question that a healthcare provider is going to ask you. So it makes it very challenging for our community to then seek out that care, because why would you want that judgment? We're fortunate. Lots of us have connections to family members who are in the healthcare system, Métis nurses, doctors, we're everywhere. So there's often that phone a friend. We also have that connection. Some of us are fortunate enough to have that connection to traditional medicines. So we may phone a traditional knowledge keeper or elder in order to solve those problems. But it is still a problem.
That's another thing you've just identified that's, I guess there's a certain degree of irony, but maybe not, is knowledge holders' traditional forms of medicine in the Métis communities is very, very ingrained. It goes back hundreds of years. So you've got this hitting this racism wall in the colonial, I guess what you would call it, institutional healthcare system. Mm-hmm. But meanwhile, then you've got like this great faith and knowledge in other kinds of, I guess, holistic or non-traditional, non-pill popping medicine. How does that play into the Métis sense of health and well-being?
Well, I think there's a large diversity, right? So I wouldn't say that blanketly every single Métis person across Alberta or across our nation has knowledge of or utilizes traditional plant medicine. I would say that most of us respect it, even if we're not connected to it. And I often wondered if more people would be connected to it if the existing system were open to it, which right now, unfortunately, it is not. You'll get great clinics that will have practitioners. The Indigenous Wellness Corps, for example, that runs through Alberta Health Services is an example where traditional medicine is more likely to be applied than the mainstream acute system, specifically because it is run by Indigenous physicians or allies. But for the most part, I would say there's still a lot of Métis folks that aren't connected to that way of healing. They would like to be, but it isn't something that is easy. There's a lot of history, and so folks read about it, but it isn't something, whether that's because folks are scared to share their knowledge, whether that's because it truly does require a connection. So for an example, we'll get folks calling the M&A all the time to access traditional medicine. Well,
oh, interesting.
Yeah, but the reality is those are community-based resources, right? I don't just phone up a card-carrying elder or knowledge keeper and expect that somebody's going to bring me some rat root because I have a cough, right? There are protocols involved. There's a relationship involved. And so it is very hard, or harder than I think community would like it to be, to access those types of medicines. And that is something I think that not just our health department work at, but collaboratively across the M&A, all departments are really working to reconnect to who we are traditionally as well as who we are contemporarily, and finding how we walk that line.
That's a good way to put it. We've been talking with Reagan Bartel here at the M&A office in Edmonton. We'll take a short break. We'll be right back.
Today, we are talking about a very important topic, health. And when we think about the history of the health of our Métis people, I think back to 1934, when the UN Commission was set up by the government of Alberta to look into the conditions of the Métis in Alberta. And one of the key pieces was health. We know that report provided some recommendations on what needed to be done. We fast forward to 1982, the amendment to the Constitution, where finally the Métis were included as one of the Aboriginal peoples of Canada. And I know for a lot of us, we thought, now things will begin, things will happen, including having some opportunities to look after the health of our people. It has taken a long time, and only now are we seeing some results. We finally had the opportunity to do health research to actually know the details of the health of our people. More recently, we've been able to access some resources to do some health programs. But of course, for the Métis Nation of Alberta, we've worked a long time on designing what a health system for the Métis Nation within Alberta would look like. And finally, we are getting to that point. It will be great when we finally can see the results of all the work that has gone into figuring out exactly how we can be supported by other governments and look after our Métis people's health.
We're back with Reagan Bartel. Thanks again for joining us today.
My pleasure.
So in the book, we have a chapter on health called Seeds of Wellbeing, health programs. It's in the community section. The book has 3 sections. And in the second section on community, we have various themes, and this is one of them. And we talk about the first ever report that the Métis Nation of Alberta released in 2013, so that's 10 years ago, on health, on the status of Métis Albertans, called Health Status of the Métis Population of Alberta. And I'd like to read a quote from this, which I believe you wrote, which was very beneficial to the purpose of our book. It says, the report noted a higher prevalence of diabetes, heart disease, hypertension, respiratory disease, and stroke in Métis compared to non-Indigenous Albertans. The Métis do not experience poorer health because they are Métis. It is due neither to their ethnicity nor cultural practices. Rather, these health outcomes recognize the impact of years of colonization challenges. And we kind of touched on this a little bit in the first part, talking about racism. But these are some pretty challenging health issues, because those ones I've just itemized that you're familiar with, any one of those could do you in.
Absolutely.
Right? So jumping off of that, and I think you mentioned there's another one coming up, the second report up. What using that report, or what, since you've come to the job, what are the kind of programs that you've thought are best suited to put in place that would counteract that, or other challenges that you've come up with?
Well, you absolutely nailed it, David. The reason why these reports are so important is because we won't know what programs to build if we don't have that understanding of the unique health experience of Métis within our own province. And so these reports were foundational for how we built out programming. Obviously, if heart disease isn't something we're picking up, we're not building programs for heart disease, right? So these reports are foundational for program development. We are excited to be able to, within the next year, you can imagine the work that goes into creating such a comprehensive report, because it really does cover everything from health utilization in that report to conditions like you've just listed. So we have the second version of this report that's coming out. So we'll be able to have a comparative over kind of the last, 15, almost 20 years, which is exciting. What I would like to draw attention to is the part of the quote that talks about our community not having poor health because they're Métis. So we often even hear this amongst our own community members. Oh, I have diabetes because I'm an Indian, or I'm Indigenous, or I'm Métis, or whatever the term they use. And that's simply not the case. People don't have diabetes because they're Métis. And yes, there are genetic conditions that can predispose you for things. But when I talk about it being as a result of oppressive policies or assimilation or colonial influences, it's all of those external factors that have worked against Métis people. Not the individual, but Métis people as a whole, that have made it difficult to access doctors, difficult to access preventative care. We may have lower incomes than an average community member, or lower education. Not saying all, I don't want to overgeneralize. But because of those things, we have poor health, not because we're Métis. And I think it's really important for even our own community to understand that, you're not born and predisposed to these things, but you have things working against you in the system. And that's what our health department needs these reports for. Not just to build programs, but to build advocacy. We're essentially absent from health literature. So the Métis Nation has done this incredible job in intersecting all of these unique experiences. And as a result, we are building programs. You can look at our tobacco cessation program. It is unique in that it is built out of community engagement. We talk to community members. What helped you be successful on your smoking cessation journey? Would you come to a program even if you weren't 100% sure you wanted to quit commercial tobacco? So all of those things have been woven in and created this incredible cultural safe program that is so great that actually Alberta Health Services has asked us to develop a manual that is Métis specific for their quit core programming. All credit to my staff, Kyla, who has done an incredible work as our certified tobacco educator. And what we can say that's different from our programming to other programming is that we're iterative. So we built this program, we thought it was good, we went back into community, we validated it, we're having people attend, and it's wonderful. And then somebody says, wouldn't it be great if we had a peer support group attached to that? I don't have to seek bureaucratic approvals. If my community tells us we need something, and I have within the grant that we're working with the ability to do it, we just make it happen. Now we have this incredible peer support group where we have women who have succeeded in their journey, whatever that looks like for them, who are supporting other citizens. It's that kinship and community that you'll see woven throughout your book in real. We see people who are doing well that want to help others do well. And that's the power of the Métis community. That is what drives my passion. We're also working on a cancer strategy. So we've published it. It's out. It outlines key spaces where not only the M&A can have an impact, so we can do things like resources, advocacy, all of those components, but it also is a call to action and recommendations for the cancer care system within Alberta, asking them to see us, to hear us, to build programming that is relevant to us, and a call for the broader provincial and federal governments to support cancer care in Alberta. I'll never forget holding that man in my arms that collapsed that said, my best friend died of cancer because he chose to put food on his family's table rather than paying for transportation to get to his cancer treatment every day because he couldn't afford to do both in Canada. So our cancer strategy holds people to task. That's not okay. It's never okay. It's not okay in Canada, in the province of Alberta in 2023. And so my team is excited to be able to continue to advocate and hold that space for our cancer survivors. We're working on building out on the land healing programs, which I know everybody is always excited about.
Wow.
I am also excited about.
Let's hear about that.
Right? So we've had a residential school survivor healing retreat. We've had a men's and a women's healing retreat. And so we've chosen different locations. Sometimes we're at Métis Crossing because we know being in a space that is on our own homeland.
The world famous destination
Métis Crossing.
for tourism. Yes, we get the plug in there.
Oh, I know.
We love to talk about Métis Crossing.
We do, but the reality is there is something about stepping on the land that is just, it's healing. I don't want to say it's more so for Métis because I can only speak for myself in this space, but community has said this is what they want, so this is what we're doing. We're really fortunate to be able to use some of our mental health dollars to be able to do that. You may have seen there was, I believe, a CBC report with the residential school survivors who talked about how it was beyond meaningful to have these opportunities, and that's life promotion. So what you don't see in the report or in the quote is the conversation around non-traditional wellness, right? So people are quick to invest in hospital care. People are really quick to invest in pills. You think of that as being health and wellness, right? I'll get myself a treadmill, I will be well. But what they don't understand is that for our community, wellness is broader than that. It is more holistic. And when we talk about life promotion, we're not necessarily talking about pills. We're talking about coming together to dance. We're talking together about coming together to eat. We're talking about going camping together. We're talking about simply even coming together to share a space to bead. Those are non-traditional ways of being well for the general Canadian population. And it is a struggle, I think, for folks who don't understand the connection of being in community to wellness. Identity, community, and kinship ties matter. They keep us well. It's not just about all of the other, I ate an apple today, that'll keep the doctor away, right? It's about having those social connections and connection to culture and knowing who you are. Those contribute to well-being. And those are also things we explore in all of our reports. We try to contextualize, put the stories behind the numbers, right, in the reports that we
The mental health and the physical health, it's an interesting connection that if you look at culture and feeling part of community, then they go hand in hand.
Absolutely. Absolutely. And community tells us that. I mean, I personally feel the same as a Métis citizen, but community tells us that. And so it's my pleasure to be able to amplify that. And we have been fortunate in that we have put out a life promotion guide. And so for folks who are listening that are not quite sure what life promotion means or how do we even get started, because it's strength-based, right? We tend to, when we look at health, so-and-so's sick, and therefore we treat the sick. But what if, I know this is crazy, David, but what if we started earlier than that and just kept people well? I mean, there's an idea, right? And it takes a little bit more investment in things that people might kind of raise an eyebrow at, because who's going to pay for a jigging class? But the reality is that's movement, that's social connection. Those are all things that contribute to every single thing on that list you read. Right?
So just to reflect a bit on my life in Winnipeg and my friends there, life promotion in your view would not be defined as sitting on the couch on Sunday afternoon, drinking beer, watching football. Really?
It wouldn't be how I defined it. Now, if you're having incredible conversations and you're connecting to your community, who am I to say, right? Typically, from a health perspective, no, I'm not condoning being sitting stationary, having alcohol as a life promotion activity. However, the conversations that happen in that space, if you removed kinds of those kinds of things, that connection, maybe an intergenerational connection where somebody is listening to stories about where we came from. I'm not going to judge people cracking a cold one. That's definitely not my role. I'm here to support folks if they decide that is an issue for them. However, having a cold beer and learning what Cookham did back in the day, learning how they lived before you had access to Google and your phone and all of those things, that is health. So it's about the context, right? But yeah, as a health director, I'm not going to go on record saying absolutely sit there, eat those chips and have a beer. But I also personally am not going to judge people who do.
No, but it's when you picked up on the part of the quote that, the Métis do not experience poor health because they're Métis, you and we elaborated on that. And you talked extensively about some of these programs that you've been working on, which sound amazing. But you've been reminding me of a writer in the Globe and Mail who writes once a week, and her name's Leslie Beck. And she writes about health alternatives, health, she's one of these, how do you get away from meat, plant-based diet, legumes and beans. And so these issues, Leslie Beck would say, well, no, these are not issues that plague Métis for being Métis. These are issues that are plaguing Canadians for not embracing and living the way of all the things that you've just described. I think about my own grandmother. I think to myself, well, if Leslie Beck had one thing to say in her column each week, or this was going to be her last ever column, well, just live like Dave's grandmother. I mean, she had a garden. She probably mostly had a plant-based diet, was heavily involved in her Ukrainian-Canadian community that my father managed to weed out of us because he wanted to be a melting pot, become part of the society. So you remind me of those things, and it really makes a lot of sense. I can see that, and it in the work that you're doing, you're probably seeing these programs like the tobacco and cancer and what you've described, you're probably putting it in the context of everything else you've just described.
Absolutely.
The whole community being all part of that. And that's a fascinating idea because we live in a very isolationist society, right? Like a really high percentage of people live alone, right? And all these things have health implications, don't they?
Yeah, they absolutely do. I would just say one thing. I think we would all be privileged to live like our grandparents did, to know that they could take the time to grow things, to know that, if they wanted to barter for things, they could, to know that they could go to the grocery store and not spend, $10 on a loaf of bread or a jug of milk. The reality is that a lot of people don't have that privilege. And so, when I listen to, people saying, oh, well, if people just ate this way, that's often the conversations we'll hear in our diabetes stuff. Well, they tell me I need to eat this. Who's paying for me to eat that way? Heaven forbid you live in the north. Even if you can afford to buy things on the shelves, that doesn't mean it will actually exist on the shelf. So, I do think it is a broader Canadian problem. I think when we look at our demographic information, Métis people kind of are edged out, like we do experience more inequities in these spaces. And it is simply because we're catching up, because Canada left us behind. Not all of us. I mean, if you look at our education, and you had indicated that, you had talked to some of our folks at Rupert's Land Institute, I know there are educated Métis people across I'm one of them. I'm fortunate enough to have a master's degree and a bachelor's degree. And I'm not alone. There are thousands of us. We are very well educated. So we're catching up, which is why we have the privilege to contribute to this space. And I can argue and say, well, it's a little bit more complex than just eating that way. You have to have the privilege of affording
That's right.
to be able to
That's
do
right.
the things, right? And all of us now, we work. We work to live. We don't live to work and play. We work to live. And so I think that our vision for health is that we're connected to community, and we're not just existing. We're not just living. Métis people in our province are thriving. And that won't come without the understanding. And it doesn't come without the gift of visiting with our community. And I think that's something that's really important. And I hope that if there are any Métis citizens that are listening to this podcast, that they understand that I read every email that comes. I read every engagement that is done by my staff. And I share that with leadership. And I have quite a reputation for arguing at all levels of government to hold folks accountable for the inequities and the bad investments or the lack of investments that have been made in Métis health.
You mentioned about getting access to quality to foods. There's a lot of research in this, and I'm going to ask you in a minute because you had mentioned before we started about the research component of the work that you do. But it's interesting when we hear all these statistics about, this is what you should be eating, this is what you should be doing. But at the same time, we have this massive marketing campaign going on in advertising, billboards, everywhere you go, and in the grocery stores, sporting events, you name it, where they're throwing these ultra-processed foods at you. And I've read, again, in a column by Leslie Beck, which this is suitably terrifying, where she said like we don't realize over 60% of what we're eating is ultra-processed foods. Those are the ones where you don't even know it's ultra-processed. So you could be going to Tim Hortons or Starbucks and getting something that comes out of a wrapper, and you're just trying to get some sustenance before a flight or whatnot. Then there's the processed foods. Then there's the food that was cooked, and then there's like the straight out of the ground, the carrot like grandma used to make, and that's the small minority, right? So that the monumental challenge when so-called colonial Canadian society is being bombarded. Imagine what chance do you have, especially if, as you say, you live in the north, and it's easier to get that stuff up there. It's cheaper. It'll last longer. Yeah, best before 2026.
Yep. You know what? I think our community has done a really good job of reconnecting to the land. I know that our harvesting team has worked so hard, and our leadership have worked so hard on harvesting rights. I'm not going to get into that because you will have angry phone calls, because I know it's not perfect. Don't come for me. But we have been working hard, and they are continuing to work hard. And I'm seeing more and more traditional foods coming to community events.
Oh, really?
Wow. I'm seeing more folks that potentially are are getting their first deer off the land because they've reconnected through the M&A to some of the, responsible harvesting educational programs that are put out. And so I think that the Métis Nation is combating kind of some of those access challenges, was trying to remind community what actually can be provided for, in a sustainable way on the land. I know that my nephew benefited from learning how to ice fish, and has done so, right? So there are ways where Métis folks, when we talk about resiliency, I hate that we have to be resilient, because it almost feels like people wear it as a badge of honor, and it's like, oh God, you don't understand. I don't want to be resilient anymore. But I see it in our community, and that they are going back to the land to try to fill those gaps instead of processed food. They're going out as a community and sharing a moose tag, right? With family, of course, not getting anybody in trouble, because I know there are restrictions on who can hunt. But certainly I'm starting to see that resurgence and reconnection. And I'm very proud of the role that the Otipemisiwak Métis Government and the M&A has played in that, because I know for a fact that there are children that had never thought of fishing before that now fish to help support and supplement their families.
That's great.
I think that's incredible. That's who we were traditionally. And isn't it great that we can carry that through into contemporary times?
Just to digress for a second, and maybe we're not digressing, but you just made me think about, can you imagine how unbelievably healthy the Métis must have been given the lifestyle of the 1800s, of the
how mobile they were.
The fur trade. I mean, my goodness. I mean, they're basically doing 10 or 20 marathons in 6 months. They would take the fur from where we are, was once upon a time Fort Edmonton, all the way to Montreal. They actually built what became the roadways, unbeknownst to most Canadians, who go flying by at 120 kilometers an hour.
Absolutely.
So it's
when we talk about reconnecting to culture, we often think of things like beading, jigging, I'm going to learn how to make a sash, but actually telling stories and being mobile are absolutely foundational to who we are.
And imagine what Métis were doing in their recreational time, given what they were doing with their work time. You've got enough energy left over to fiddle, to jig.
Absolutely. Dance with your broom, of course.
I mean, it's so remarkably physical. I mean, the conditioning must have been just incredible.
I can't even imagine. I mean, as folks might imagine, I spend a lot of time behind a desk, writing reports, reading reports. So yeah, I think that connection to mobility is something that a lot of us could benefit from. A reminder that we actually historically were very mobile humans, right? Let's get out for a walk.
Isn't it interesting how we've so completely institutionalized, so-called fitness?
Yep.
Come to this gym, get on this machine, set it for 45 minutes, walk really fast.
You know what? I have a friend and colleague who has told me, oh my gosh, probably every day for the last year, that Reagan, all you need to do is walk 15 minutes one way, turn around and walk 15 minutes back. And the impact of that 15 minutes in both directions is incredible on health. So it is cheap. But again, I recognize privilege. If you're working 3 minimum wage jobs to be able to afford the healthy food you need to eat, to be able to put a roof over your family's head, then finding 15 minutes one way and 15 minutes another is hard. And that is why we continue to fight and advocate at the Otipemisiwak Métis Government to have things like health benefits and mental health programming and things of that nature. Because we know that the reality is not everybody is going to be able to find that half an hour in their day.
Or you're spending it watching your kids do something.
Yep, exactly.
I had mentioned a moment ago I was gonna ask you if you wanted to talk at all about the research work. And a lot of what we've talked about would touch on that, but if you wanted to expand a bit.
I think it's important. And the reason why I think it's important is because I think research has a bad rap in our community for obvious reasons, right? There's a lot of trauma associated with research, things being done, studies being done about us without us, to use that cliche phrase. I tend to think of our research portfolio more as visiting. So we really are trying to visit with the numbers and visit with the stories that our community members gift with us. Because right now, if we don't, we have this gap. We're silent in the health literature. And the reality is, to build programs, you have to have evidence. Now, I would love to say that having, somebody call me up and tell me that they have a problem, to me, that's enough evidence. But when you're looking, at funding programs and sustainably funding programs, that's not it. So we have to have a robust research portfolio. And I think that it's important for community and people outside community to understand the value of investing in Métis research. Because a healthy Métis population is a healthy Albertan population, is a healthy Canadian population. So that investment in research is actually, it's exponentially valuable, right? Mm-hmm. It trickles down to everybody, especially because we know we're in the workforce. Like, why wouldn't you want us healthy? So we need to understand that. Those gaps, have been filled with pan-Indigenous research. So research that looks kind of more broadly at Indigenous people as a whole, so it can include First Nations, Métis, and Inuit. The challenge in there is that we are different. There are unique differences. And so it's been my pleasure to be able to contribute to that. And the M&A has an incredible research portfolio. All of our research reports can be found online at the Métis Nation of Alberta website. So I would encourage folks who are listening to have a read. We have taken steps to really try to integrate stories into our current research. So you'll see kind of like those crunchy numbers reports that really, let's be honest, even I have a hard time reading them. But the qualitative components, I'll use Awawasit. So our experiences with pregnancy and birth. We sat with Métis mothers, Métis grandmothers, Métis aunties, and talk to them about what they needed to have a healthy pregnancy and birthing experience. And it is informing, the programming that we're developing. We have partnerships with Métis midwives. We're training Métis birth workers in our community directly as a result of that research. And that's the important link, is really understanding that when we contribute to that body of knowledge, it's showcasing who we are and what we need. It's easier for us to move down that pathway of actually moving research to action, which is what community cares about. It's ultimately what I care about. I don't want to do research for the sake of research. I want it to matter. And so our research portfolio is really quite good. And I'm really proud of the way we're not taking on research that doesn't matter to community. So when we go out and ask what priorities are, that's where we research. We make sure that we are honoring what people tell us. And I think that that's not necessarily what a colonial government does. No. Right? Like, I honestly, I know it probably feels so slow to people who are waiting for programs and services, but the fact that we're actually building them from what you tell us and from the research and the stories that you gift us, that's Métis. Mm-hmm. That's not colonial. That's us actually listening and doing things in a good way. So I'm quite proud of our research portfolio.
Yeah, most colonial research pretends that people don't exist. It's just the numbers.
Yeah, right?
It's just the statistics.
Exactly.
So I'm going to wrap up. You've been so generous with your time. I have two more questions. Yeah. The second last one would be whether or not you would want to share a preview of your next report with us. There was one done 10 years ago.
You know what?
Can we break the story here?
I can't give you a snapshot. And I'm going to tell you why, is because when we do research, we validate everything with participants first.
For sure.
And so I would actually be breaking a promise that I made to community members.
No, fair enough.
They get to see it first.
And it comes out in 2024?
It should come out in 2024.
Oh, yeah. I see. I didn't realize.
Yep.
So that's,
no, it's coming out in 2024.
Still not quite at the galley stage.
We're in the analysis phase.
Okay. But in a roundabout way, using my old journalistic tricks from journalism school, I'll change the nature of the question. See if I can fool you into not realizing I'm asking the same question. What's your prognosis for the future of health?
This is a great question. I'm excited.
Yeah.
We are starting to see movement in health. We are actually at the table now. We didn't have Métis-specific programs even 5 or 10 years ago. So we have our own health subtables, both at the provincial level and at the federal level. We're starting to talk things like 10-year health accords. We're starting to talk health legislation that is distinctions-based. So, I mean, wow, I sound like a nerd, but I'm so excited about it because the potential for us to actually drive the bus. You know, we've been passengers. We've been subject to the whim of whatever colonial programming comes out. You know, we have to flex and be responsive to the current Alberta health system. We don't have a Métis health system. And so we're starting to see that light on the horizon, and people are starting to understand that we know how to build it if we're given the capacity. And we actually have that cultural safety component that could make a difference. So I'm hopeful. I'm excited. You can probably hear I'm passionate. I think that we're moving in the right direction. You know, I'm guardedly optimistic about extended health benefits. I mean, I've been fighting for 4 years. And before, when I first started, if you bring it up, the conversation would immediately be shut down. That's not the case anymore. They'll at least listen. I mean, we might get the jurisdictional mumbo jumbo later, but they'll listen. That's different than it was. Yeah, we're starting to see language shift, you know, where it's not just pan-Indigenous approaches. Their first stop is distinctions. They may not always get it right. That's why we exist, is to support. And I think that's one of the other things is I'm starting to see collaborative approaches to health. We're not, historically, we've just been fighting all the time, you know, fighting and clawing and trying to get everything. And we still do that. I don't want to give that impression, but like we're starting to see now when we're fighting and clawing that people will reach out a hand and lift you up and support you. They're still letting you fight. They're not giving you the voices. They're not giving you the answers, but they're giving you a platform to actually get to a place where Métis health is at the front of the line. And I'm excited about self-determination, to be able to say, you know what, our community members have told us we need this. And to be able to say, okay, well, let's build it then. Wow. Can you imagine?
So I lied. I guess I'm going to ask you one last question because you've just inspired me. When I was researching and writing this book with Patricia, we have a section on recognition and community and reconciliation. And so for me, as a kid from the suburbs of Winnipeg, Fort Garry, without knowing the Métis significance of Fort Garry, because that's just how uneducated our history was in high school. The recognition section, the history of the Métis Nation, the road to the Constitution, a hunt for justice, harvesting, and getting a seat at the table in negotiations, economic development. These all seem to be things that made sense to sort of a burgeoning nation. That's you can understand that from the history you've been taught. But the second section about community, which is where we've put the chapter on health, as well as on women and youth and veterans and elders, and that whole, it kept hitting me that how did they do this when they have to do all of that, when they have to get the recognition, and yet still able to build these programs. And really what you did is just made me realize you just made me remember during the book how impressed I have been with the way the Métis have been able to do. Because like you say, it's almost like you're in a straitjacket. Say, develop this program, but you don't have the jurisdiction, you don't have the budget, you don't have the authority, you don't have,
Yeah, we do a lot with very little. Absolutely. And that has changed. We're starting to see investments. But I think the other thing about your comments is you realize that health is in all things. There is no government if you don't have a people, and you don't have a people if they're not healthy. And so the Métis have always prioritized health and well-being. They may not have stated it explicitly, but they walked, they moved, they danced, they were together, they were proud of who they were. Even when they were hiding, they held on to that. That's health. Health is in all things. And my colleagues and I always argue about this, right? Because I like to just pretend I'm super important as a health director, right? But the reality is you don't have a government if you don't have a healthy population. And so, health is a right. Health is an inherent right. Recognition is part of health. So it's really validating for me to hear your thoughts, right? Because it aligns with what community has said. Health is everywhere. Health is in all things. And we need to start seeing it move into health in all policies, health in all ministries, because if we don't kind of come back to that foundational piece, then what are we doing? You can't build programs for people that don't exist. You can't have rights for people that don't exist. So we need to make sure we do them concurrently, because you can't do it separately.
Great place to end. Thank you so much for your time. I'm really excited about your report in 2024.
Absolutely.
And seeing the other work that you're doing coming to fruition. We've been talking with Reagan Bartel here at the M&A office in Edmonton. Thank you so much, Reagan. Much appreciated.
Thank you.